Hi, my name is Mason,
And I'm Katie.
and we're going to be talking about infant feeding with the method of the Sophie method.
In the semi-elevated side lying position.
Okay, so the Sophie method is actually the acronym for Supporting Oral Feeding in Fragile Infants. So this is actually a bottle feeding method and have different type of questions, like yes, no questions, and decisions that you're going to make that are going to lead you into the following actions. And the options for these actions are to proceed along the algorithm to continue feeding as is, to make a change to support stability or otherwise improve the feeding experience for this infant, to defer the feeding to a later time and save the remaining amount of milk and formula, or to stop this bottle feeding. In this type of method, it's extremely important for the nipple flow rate to be adequate for the child, for pacing to be monitored, and for the positioning of the child to be adequate. And these will ensure that there is going to be a safe and effective feeding and efficient feeding as well. So this study in particular that I looked at was setting the stage for successful oral feedings. And this looked at a group of NICU infants that were in the level 3 NICU in particular, and they were monitored by the nurses that had been trained with this Sophie method versus the nurses that had been trained after the Sophie method. So the children were given the pre-Sophie nurses versus the post-Sophie nurses. So they did this, and this impacted their oral feeding, the growth, the length of stay, the outcome of the discharge in general. And then they checked this again 3 to 5 months post-term after they left the hospital. So the treatment protocol itself was that they gave the nurses in this hospital the Sophie method trainings. That happened. They checked the outcomes within the hospital, and then they also did a parent phone call interview to look at some of the data of how the babies did once they left the hospital. And we found that to be very telling for this type of study. So the conclusions of this study were that the study really showed a positive influence on feeding outcome and getting back to oral feeding for the patients and following their discharge after. So after they were looked at between the two pre-Sophie and post-Sophie groups, the post-Sophie group were able to attain a full oral feeding in significantly fewer days than the infants in that pre-Sophie group. As well as when we went and did the phone interview, you were able to see that the parents from the post-Sophie infants reported fewer feeding problems, less arching with feedings, less spitting up and vomiting with meals, and they were treated fewer times by a feeding therapist after they left this NICU. That no significant differences were reported for choking, sucking, coughing, gulping, or duration of feeds, which is great. And then clinically relevant, it was shown that this Sophie method was able to decrease that transition time into the oral feedings, which is hugely important, especially for keeping these babies maintaining their adequate abilities and getting out of the NICU as fast as they can. Also, it was able to help build and develop more of an organized feeding behavior after their discharge from the NICU, because we give this parent education and intervention techniques for the parents to carry over into the home, and that will help with the infant's readiness and their ability to feed past their discharge. And it's just been very influential for the knowledge and the abilities of the parents to be able to feed their infants past discharge. So what we're looking at here, and we'll be going back to, are the actual program itself for Sophie.
So I looked at the semi-elevated side lying position, and obviously position is a huge part of feeding. This position specifically helps to improve the coordination of breathing and swallowing. It also resembles the breastfeeding position because it facilitates optimal fluid management and reduces the disruptions of breathing. In this position, the bottle is at a lowered angle which slows the gravitational flow of milk, as well as slow the transition time to the back of the oral cavity. This slowing the process of this feeding allows the infant to gain control of the bolus, which ultimately prevents aspiration. In addition, the ESL position reduces the effort of breathing because the position lessens the amount of anti-gravity movement during the feeding. The article that I looked at was a pilot study, and it used a sample of 6 very preterm infants, so that was about 30 weeks of gestational age. And these infants did not have any kind of disorders that are associated with feeding difficulties like cleft palate or paralysis of facial muscles. And the study was performed to investigate the efficiency of using the semi-elevated sideline position. They wanted to make sure it was an effective way of improving oral feeding. And so they looked at 2 different positions, obviously the semi-elevated sideline position and then the semi-elevated supine position. And in the study, they found that the SL position, the babies had significantly less variation in heart rate, that there was a fewer decrease in heart rate too. The respiratory rate was closer to the pre-feeding state, and there were shorter and more regular intervals between breathing, and there was a brief feeding related apneic event. So this position really regulates the baby. It is a great study because it shows that the ESL position is a great intervention to help with feeding that is applied to like neonatal care. So it's readily available. Once the mother learns this position, then it will have an effective feeding.
To demonstrate a little bit, so we have a little itty bitty baby. This will be our very preterm infant that's potentially in the NICU. And then we also have a Dr. Brown's bottle, and this is one of the most important parts of all of the feeding, is to make sure that the bottle and the nipple rate and flow are right for the child. So right now we're going to be having a preemie nipple on here just for maintenance of flow. And Katie's going to demonstrate our positioning.
Okay, so this is the ESL position, and we're going to put the baby kind of on his side, and you're going to get the bottle.
And so this, we're just trying to demonstrate this way so y'all can see. As you know, this is the position that is mimicking breastfeeding as much as possible. So when you're actually doing it with your own child, you'll be flipped towards the other way so that you're mimicking that breastfeeding position as much as possible. Positioning is so important for these babies to be able to regulate themselves as efficient and safe as possible. So now we're going to look at how the SOFI method works. So now I pulled up all of the different SOFI actual program method guidelines. And as you can see, we have the SOFI bottle feeding, the SOFI pacing, and the SOFI flow rate and nipple unit. So pretty much you'll start from the start, and each of these will take you down and make a decision depending on how the baby is doing. And once you're following these charts, you'll be able to make better decisions for better, safer, and more efficient feeding for the baby.
Okay, so the 2 goals that we created for our interventions were the following. So the patient will demonstrate increased coordination of suck, swallow, breathe with oral intake via slow flow nipple for 4 sucks with self-pacing without demonstrating signs or symptoms of aspiration, airway threat, or distress over 3 consecutive sessions. And then our next goal for positioning was the patient's caregiver will demonstrate appropriate semi-elevated side lying positioning of the infant during feeding independently by the end of the session over 3 consecutive sessions.
And then kind of the therapy activity that we discussed was really just observational, because this is going to be you teaching mother and you helping educate mother through this. So for the SOFI method and the data collection for it, pretty simple, because you'll just be going through the SOFI guide, marking off what the child is doing. And then for your positioning, you're just going to have whether the baby was able to achieve this position or not, and how the mother was able to do it as well, because we would want her to demonstrate for us. Thank you very much. We enjoyed telling you about infant feeding, and hopefully you learned something.